Department of Health. I'm going to start today's daily COVID-19 media briefing. We have 3 speakers today. First, we will hear from Gary Harter, who's the Executive Director of the Department of Veterans and Military Affairs. Gary will be speaking about what veterans can do to ensure that they receive their federal stimulus checks. Following Gary will be Monte Roberts. Monte is the Director of the Utah Division of Motor Vehicles, and Monte will provide some remarks about what DMVs are doing in order to reopen their lobbies. And then following Monte, we will hear from Dr. Angela Dunn, the state epidemiologist, with today's situational update. So, Gary?
Thank you, Tom and Brooke. I am Gary Harter. I'm the Executive Director for the state of Utah's Department of Veterans and Military Affairs. Our department exists to assist military, veterans, and their family members to be successful. We work with federal, state, and local organizations and partners, veterans and military organizations, academia, the business community, and many others. We work with the Office of the Governor and the Lieutenant Governor, the state legislature, our congressional delegation, the federal VA, Department of Workforce Services, the Utah National Guard, military leadership, chambers of commerce, veterans and military advocates. My main purpose for being here today is to provide assurance that our state and our local and federal partners are still working to serve our veterans community, even if some of our offices are now closed during this challenging time. Our own department is offering virtual benefits and claims appointments for veterans and their families through video conferencing and phone calls. Over 50% of our engagements over the last 6 weeks have been on our virtual network hosted on Zoom. To connect with us, please go to veterans.utah.gov. We have a Veterans Business Resource Center that works in partnership with the Salt Lake Community College, the Governor's Office of Economic Development, and the Small Business Administration to assist those veteran-owned businesses who are struggling right now. Over the past month, the department has hosted several town hall meetings and a survey to better understand the needs of our veterans and our military communities in this challenging time. Last week, we hosted a town hall that had almost 600 participants, either real time or through the podcast. We had Senator Romney participate, administrators from the VA, both the Medical Center and the Benefits Office, Department of Workforce Services, the Small Business Administration, and many others. And one of the top questions was in regards to receiving stimulus checks. I'd like to thank Senator Romney, Senator Romney's staff, and Senator Lee's staff for participating and providing some valuable information. But the IRS put out some additional information this past Friday, and we want to ensure that veterans are aware of this information if they're waiting for their stimulus checks. We sent an email out yesterday that contains the same information. So for veterans who have already received their stimulus check, they need do nothing. They're done. They need no further action. Veterans who do not have dependents and have not yet received their stimulus payments do not need to take any action at this time. They should expect to receive their checks in about 2 or 3 weeks. But the main thing are for veterans who have dependents and did not file a tax return in 2018 or 2019, you must register with the IRS at irs.gov by this coming Tuesday, May 5th, to ensure that you receive your check, especially for the $500 per child added to the economic impact payment. It's easy to do. It's straightforward. It's on the irs.gov website. And you go to the portion that talks about non-filers, press enter payment information. Again, that is very important for Tuesday, the 5th of May. Go to irs.gov. I also mentioned survey. We had a survey that responded, over 2,700 veterans and military currently serving responded to our survey. We know that this has drastically impacted our military community, especially the guardsmen and reservists. Over 75% have said that this has impacted their ability to drill and to train. Among working veterans, almost 40% have said that they've lost hours or been laid off or been furloughed due to this crisis. And we encourage all veterans who fall into these categories to apply for benefits with the Department of Workforce Services at jobs.utah.gov. DWS has adapted to assist all Utah citizens, including veterans throughout our great state. 30% of veterans and respondents to our survey also said that they've had a negative impact on their mental well-being. And we are working with many providers. We are working with the VA. We are working with veterans organizations to address this need. And 11% said that they need financial assistance to pay some of their current bills. For the VA, the federal VA, they are working to continue to provide health care and mental health care resources for veterans during this time. They have really ramped up their telehealth capability. And I encourage veterans to reach out to the VA locally at va.gov, va.gov. They also are offering testing, COVID-19 testing, to those veterans who meet the symptoms. You can find their hours at coronavirus.utah.gov, and the testing is up on the VA Medical Center. And the VA Center also has drop-in mental health clinics that they've established for the veterans who just need to reach out and talk to others as well. The Utah National Guard also has a robust services available for their guardsmen and those recently separated from the Guard, and we ask you to contact the Utah National Guard. One of the other things in our portfolio within our department are our veterans nursing homes across our state, in Ogden, Salt Lake, Hazen, and down in Ivins. We've worked hard with our provider, Avalon Healthcare, to ensure the safety of all of our 400 plus residents in our homes. And I'm very happy to be able to report at this time that we don't have any residents in our homes who have tested positive for COVID-19. We've been shut down at our homes for visitors since mid-March, since the 12th of March. I know this is very difficult on the families, but we want to really thank the families for their terrific understanding and our support. We're doing our best with our contractor to ensure your loved one is served well each and every day and cared for. We're also putting together a website a project that'll be up on our website next week, Happiness for Heroes, so that community members, family members, others across our great state can take messages that will be shown to our veterans that are residents within our homes. And for the military, our military, those at Hill Air Force Base, those over at Fort Douglas, Dugway, out at Twell Army Depot and the Utah National Guard, they continue to perform their missions each and every day. They want to ensure that we are prepared for our national defense and national security missions that they are engaged with. Where they can, they telework. Others, they bring in. But it's also worth remembering that we have hundreds of those who currently wear the uniform today that are deployed in harm's way across the world, that whether they're active duty, whether reserves, whether they're National Guard. We wish for their quick and safe return to us, and also we remember their families who are dealing with that added separation and stress at this very difficult time. And obviously, many of you have seen the flyovers that's slated for tomorrow to begin at 1 p.m., where elements out of Hill Air Force Base, the 388th Fighter Wing, will be flying across the state to pay tribute to all the healthcare workers, first responders across our state to say thank you. I know they're publishing their how they will fly as well, and we encourage you to check that out also. So again, for those that have not yet received their stimulus checks, I encourage you to go to irs.gov and make sure that you fall in. If you fall into one of those categories, please fill out the form. Also, if you need anything, if any of the partners that I've listed can be of assistance, you're welcome to connect with us at our website at veterans.utah.gov. And our email address is very similar. It's veterans@utah.gov. If we can be of any assistance, please do not hesitate to reach out for us. That concludes the remarks I had prepared for today. If there's any questions that are, if anyone wants to ask a question, I'm available to take those at this time.
Yeah. I'm not sure how I raised a hand or anything. I didn't raise a hand for this. I don't have a question.
So when it comes to the mental health capability, what other kinds of things are you doing to make sure that their mental health is taken care of? Aside from, I mean, you mentioned that there are 11% of them say that they need financial help, but what else do they need?
The question had to do with mental health and in some of the financial help. We've been able to provide some on the financial things. We've been able to provide some amount of assistance to guardsmen, reservists, some of the families, and also some of the veterans who find that they are in need for some food or gas or whatever that happens to be. Please just contact our office at veterans.utah.gov or that email address I gave at veterans@utah.gov. We're working tirelessly with the VA, both at the medical center and with the veterans clinics that are across the state as well, to make sure that veterans are connected and can talk to people if they have a need in the mental wellness area. Thank you.
Okay.
Thank you very much.
Good afternoon. My name is Monte Roberts. I am the director of the Division of Motor Vehicles. Prior to making several comments today, that I want to say thank you to several individuals, starting with our DMV employees for the dedication that they have provided during the COVID-19 restrictions. They've been asked to deal with a lot of changes and a lot of changes to work schedules, changes just in general that have impacted them in a way that I don't know that most people really understand. I also like to thank our local law enforcement community, unified police departments, as well as our motor vehicle enforcement division for their assistance in helping maintain a sense of civility with the long drive-through lines. They've been a huge asset for us. Thank you to third-party partners assisting with motor vehicle transactions outside our DMV offices. And I'll touch more on that here in a minute. As well as thank you to the businesses that surround the DMV offices. We know that they've had to put up with a lot of long lines and some issues that we've had to address. And lastly, I hope I don't miss anybody, but thank you to the vendors that have helped us to get to the point where we wanted to make this announcement today. We wouldn't have been able to do that without them. I do want to set the stage a little bit to describe how the DMV in Utah may be a little bit different than in other states. The Division of Motor Vehicles operates under the purview of the Tax Commission. Oftentimes, people think that we're also the Driver's License Division. The Driver's License Division in Utah is under the purview of the Department of Public Safety. So we are under completely separate agencies. And so the comments that I'll be sharing with you today are specific to motor vehicle registrations and not driver's licenses. Another distinction that needs to also be made clear is that in Utah, we have both state-run DMV offices as well as county-run offices. We do work closely together in a lot of capacities, but again, the changes that I'm going to describe to you today are going to impact only a select few of the state-run offices. On our website, you can find at dmv.utah.gov, you can find the status of all of the hours of operation for all of our offices, county and state-run. So I think that dmv.utah.gov is kind of a focal point, if you will, as to where it would be helpful for customers to go look for changes. State-run offices, there are 9. The changes that we're talking about today are going to apply to initially 5 offices and eventually a 6th office, which is where the vast majority of our transactions take place. I also want to make sure that it's understood that we've been working closely with the governor to draft an executive order that will give people an additional 2 weeks to complete expiring vehicle registrations. We hope that as we enter our busy time of year, that this will assist some of the individuals that can't get their renewals done timely. The big change is that we are, if you haven't heard, the DMV is moving to by appointment only. Friday, May 1st of this year, 5 Wasatch Front DMV offices will reopen to lobbies to the public by appointment only. Those offices are Ogden, Farmington, Salt Lake, South Valley, and Provo. If you don't know where South Valley is, that's in Draper. These 5 offices will provide DMV lobby services by appointment only, as I stated. Appointments can be scheduled at dmv.utah.gov, and I'm pleased to say that there have been a lot of good response already. There are a lot of appointments already being scheduled. Our drive-thrus, which have been operating with extended hours, will return to Monday through Friday from 8 a.m. to 5 p.m. Also on Friday, the Huracan DMV office will reopen with limited access. Appointments are not yet going to be available for that location. We anticipate at some point in the future that we will be able to do so. As with everything, social distancing is a must. Social distancing advisories are required, and face masks should be worn in the lobby area at all time at DMV offices. We encourage vehicle registration renewals to continue to be completed out of offices via online at rex.utah.com or at on the spot stations at spot.utah.gov. I think it's important to note that as we evolve, it's important also that the public evolve with us. And what that means is that we continue to ask for patience with our staff as they are being asked to change here again and to get familiar with the idea of doing by appointment only. If we can continue to exercise patience, we should continue to see progress. I do want individuals to understand, and I think the best way to describe what we intend to do with appointment scheduling is we're going to treat it similar to what I think most people are familiar with, which is a Disney Fast Pass, where we are going to prioritize individuals that come to these offices having already scheduled an appointment to check them in first. That does not mean that individuals cannot make an appointment, but if you arrive without a scheduled appointment, we will we will prioritize those that have scheduled them so that we can continue to utilize this as an effective service. I think there's a few other things that are important for people to understand. As part of the social distancing, we will be focusing on spacing in our lobbies. We've instructed our managers to put markings on the floor to be able to keep that spacing as appropriate. As our employees triage lines outside of our lobbies, it'll be important that people maintain social distancing outside as well. It is also imperative that you look at our website. Not all transactions will be available for appointment scheduling. So please look at our website at dmv.utah.gov. We are installing sneeze guards as barriers to assist with protection for not only our employees, but as well as for the customers that will be attending our lobbies. I'd like to end and close with just saying that, again, this is an important step, I think, not only for the DMV, but I think this will be a good solution for all Utahns, but it's going to take an effort on both parts to make this successful. So I leave that with you and close and open it up to any questions that might be there.
I don't hear the questions. I'm sorry, I didn't hear the question. Brooke, I didn't hear you ask, but it looks like I'm unmuted. I thought I heard that, Monte, that you said you had 9 offices across the state, but these changes are going to apply to 5 at first and then the 6th. Why can't we just do it for all 9 of them?
Well, there are actually closer to 36 total offices between county-run offices and state-run offices. The state operates 9 of those. 3 of our offices, we have not been able to, the offices in Vernal, the smaller offices, Vernal, Richfield, and Price, due to travel restrictions and the inability of us to get to those locations to set up measures for social distancing, we're going to move that direction, but the appointment scheduling is not something that's available in every office. It's only available through our queuing system, which is at our high volume offices. Huracan is one of those offices that has that capability, but we, again, have not been able to provide them with all of the equipment that they're going to need to do the appointment scheduling. But I don't think it'll be too long before we can get there to do that. So that would be the reasons why.
And last question. It sounded like you might be giving people an extension if they can't get their registrations done in time. You're going to be cutting them a little bit of leeway. Did I hear that correctly?
I think I'm going to reserve that question to be answered by the governor's office. We've been involved with that, but I think that's probably a better question to be answered by the governor as to how that's going to all come down there. I think there will be a news release about that a little bit later today.
Okay.
Mr. Roberts, this is Michael Orton with the Capitol News Service. I didn't hear you say that that you would be conducting examinations for driver's licenses and that some of your services would not be available. Will you still be offering examination?
Going back to my earlier comments, none of my comments are going to be reflective about driver's license. This is only for motor vehicle registrations. I'm the director of DMV, not the director of the DLD.
Yeah, pardon me for that.
No problem.
Mr. Roberts, this is Lee Davidson with Salt Lake Tribune. Just want to make sure of something. At one point you were calling this by appointment only, but then you were talking about like a Disney Fast Pass where people can still show up. It sounds like you're doing both. People can show up and make appointments.
We are doing it by appointment only, and you're correct that that's probably not completely clear, so thank you for the question. We are still going to be doing it by appointment only. My comments to that are to the effect of you can make an appointment before you show up, or we can assist you with making an appointment when you show up. If you already have an appointment, then all we have to do is check you in. If you do not have an appointment, we can either direct you where to go make an appointment if we're busy, so that we can help others to check in and keep the line, so to speak, moving. But we are still planning to do everything by appointment only.
Thank you.
Hi, Monty. Chris Reed, St. George News. Can you elaborate a bit on the reasons why the Huracan office won't be opening, and when do you expect it to fully reopen?
Certainly. The biggest reason is they don't have the equipment that's needed to make that happen. We have to provide them with some of that in order for it to be functional. So until we can get that to them, that won't be available to Huracan. But if I was to guess right now, I would hope within the next couple of weeks we would be able to make that available.
Thank you.
Okay, good afternoon. So for today's daily COVID-19 situational update, we have 4,495 cases of COVID-19. That is an increase of 152 from yesterday, or a 3.5% growth rate. We've tested over 105,000 Utahns for COVID-19, an increase of 3,139 from yesterday, and we're still at that 4.2% positive rate. We did increase our number of hospitalizations by 13 yesterday, so total hospitalizations are 383, and we have no new deaths to report. So our total mortality from COVID-19 till this point is 45. It is important to know that as we start to move towards orange and start to open up parts of our society, that there are going to be some individuals who still need to practice extra precautions to prevent them from being infected with COVID-19. And these individuals include those over the age of 65, residents of long-term care facilities, and individuals with certain underlying medical conditions. It's still going to be really important for these individuals to stay home as much as possible and practice social distancing. And if you're someone who cares for an individual in these high-risk groups, it's important for you to protect yourself from COVID-19 as well. So when you're out and about, practice social distancing, use good hand hygiene, and when you're providing care, make sure you wear a mask and certainly stay home if you do have symptoms consistent with COVID. This will prevent any infections from getting into our vulnerable population, and that's very essential as we move to orange. With that, I'll take questions.
Hi, Dr. Dunn. Hey, over the last several weeks, I've asked both you and the governor about plans to limiting out-of-state residents traveling to Utah for pleasure or for non-essential business. And there seemed to be made some progress, but going forward, is there any steps to make it, or at least take away the welcome mat? And if there isn't, am I asking the wrong question? Because it just seems from my perspective that logic would dictate if we're opening up the state slowly to ensure success, we don't want to have people coming in from high risk areas, potentially bringing in new clusters, which is the whole reason this problem started in the first place in Utah.
We have no plans currently in our response efforts to close our borders to any visitors.
Now, is my thought process wrong on this? Because like I said, it just seems like that would be a prudent thing to do, especially when you have neighboring states like California that are going to be in a shelter in place through May. Common sense would say a lot of those people are going to want to take a vacation. And hey, if we're going to go anywhere, let's go to a place where the virus, isn't really percolating as much as here, and it's a place where we can kind of go to restaurants and stuff like that. It just seems like that could introduce, again, clusters. Again, am I thinking along this process in the wrong way, or is it just because you guys are limited with what you can do?
No, I mean, there's a lot of kind of unintended consequences to shutting down borders. Limiting travel of individuals can limit families from seeing each other, can limit essential goods from getting into Utah and leaving Utah. So it is an economic strain as well whenever you close borders, whether internationally or domestically. And so it's just not as simple of a decision to just, say we're not going to allow anyone from a high burden state to travel to Utah. Typically, those decisions are made at the national level when they put any travel restrictions in place. As we saw earlier in this outbreak, with the CDC advising, those from New York, Connecticut, or New Jersey to be quarantined when they do travel to a new place. But right now in this pandemic, we don't think that is a need right now. We don't need to close our borders to continue to control the disease here in Utah.
Okay, thank you.
Mm-hmm.
Yes. Hi, Dr. Dunn. This is Carter Williams with KSL.com. Looking back, I mean, there are some famous cases from previous pandemics that restrictions were lifted too soon, and it led to a rise in new cases. Are you concerned that something like that could happen again?
We're certainly prepared for it. I mean, that's whenever you start lifting restrictions in the middle of any outbreak, it's important to be prepared for a potential surge. We are hopeful that that's not going to happen, and we're putting measures in place to ensure that it doesn't, but it's always a possibility. I think the move to orange is definitely aggressive, but it's not, out of the ordinary. We're putting everything in place to ensure success, and that's important to be able to balance, ensure the control of COVID-19 while still protecting our economy. And I think we're striking the right balance in this case. So we at the health department are definitely continuing our efforts to increase contact tracing, to ensure that those who have symptoms are getting tested so that we can continue to identify hotspots and control them that way. So while it is a possibility, I don't think it's likely. I think we have the ability to control the pandemic here while we're still opening up parts of our economy.
Quick follow-up to that. Some of these previous cases, it was restriction, and then it was open to life before those restrictions. Yep. How important is it to have this tiered system? It's
very important, and it's a smart way to do it. So it allows us to open up the economy little by little while still protecting our vulnerable populations, those at highest risk for severe disease. And then we watch the data and we see what happens. So we're going to do everything in our power to continue controlling it. If for some reason we see an uptick in cases, we have that ability to put those restrictions back in place that have been working. We don't foresee that happening in this case, but that is an option. And so it is a very smart way to do this kind of slow rollout of the economy.
All right, thank you.
Hi, Dr. Dunn. Roger McDonough with KCW Public Radio. I am wondering if, in terms of that uptick that you just described, can you remind us the specific metric that will bring us back to the red zone, when you would, imagine going back to the higher risk level in terms of case counts rising or whatever? Is there a very specific metric for that?
Sure. So we're working on the actual specific metric, but the principles we're abiding by are, number one, ensuring that we're not going to overwhelm our healthcare systems. We want to maintain capacity both in our routine hospital beds, our emergency rooms, and our ICUs to be able to care for all individuals with or without COVID. And we have that capacity right now. The other pieces are going to be our ability to test anyone who has symptoms consistent with COVID or is a close contact of someone with COVID, which we certainly have that capacity in Utah. And then, of course, contact tracing. We've got robust contact tracing in place now, and we know that will continue so that we can continue to see a decrease in cases. So if any one of those metrics shifts, so if we start to see, a surge on our medical systems, if we start to see cases that have a lot of community spread, so we can't identify where they got COVID from, those are going to be signs that we need to start looking at our policies again and see what interventions might be useful.
Can I ask just a quick follow-up, which is, I know this is kind of rehashing a little bit, but could you possibly provide a bullet point of what is required around the state when we move from red to orange tomorrow? Basically, if you're a resident or if you're a business, the most immediate impacts on the residents of Utah are
Yeah,
What?
so for residents, the most immediate impact is the ability to gather in larger groups, but we're still recommending maintaining social distancing when you're not in these specific groups and wearing a mask when social distancing isn't possible. And then for businesses, there's specific guidelines on coronavirus.utah.gov under the Utah Leads 2.0 plan. There is a document that has phased guidelines specific for every industry, so restaurants, gyms, personal care services, that allows them to see that. So essentially, we're allowing businesses to open while still maintaining social distancing practices.
Thank you.
That was more than a bullet, sorry.
That's fine.
Thank you, Dr. Dunn. First question is concerning Costco here in the state, at least I think around the nation, in fact. They're going to be requiring all customers to also wear masks as they enter. Do you see that as being a guidance for other retailers in the state? And I do have a follow-up after that.
Sure. So, as the governor and lieutenant governor announced yesterday, it's essential that every Utahn wear a face covering when they are out in public, and social distancing is not possible. And that's to protect others from your germs. And so if retailers such as Costco want to encourage that and provide that opportunity to their customers, I think it's a good thing.
And to follow up on the earlier, obviously, we were mentioning the importance of those over 60, those in nursing homes, to maintain basically a stay safe, stay home situation. You also mentioned those with underlying conditions. Are there what specific underlying conditions should people be most cognizant of as far as maintaining?
Sure. Yeah, so the underlying conditions that tend to lead to more severe COVID-19 disease include obesity, hypertension, and also lung conditions. And so there are a lot of individuals out there that have these conditions that need to make sure that they maintain social distancing and stay home as much as possible so that they don't become exposed to COVID-19 and potentially suffer those severe effects.
Yeah, I wanted to bring up Highland Cove in Mill Creek. Are you concerned about the death cluster there? Does this change anything about the state's involvement or strategy? And then is there any insight into why it got so bad here as opposed to some of the other places around the state? And I do have a follow-up as well.
Sure. So we've had a couple of long-term care facilities, unfortunately, in the state of Utah. We have responded very quickly, and so have the facilities, and it has actually resulted in fewer deaths than we've seen in other states. However, we do realize that any death is one too many, and so we're working very closely with these facilities to ensure they have practices in place to prevent outbreaks in the future. So in general, long-term care facilities, when they identify anybody with suspect COVID, they immediately isolate that individual. And then our health department team has a mobile testing unit that goes out and tests everybody. So staff and residents, and immediately cohorts the patients so that those who have COVID aren't exposing those who don't. And that's something that's happened in every long-term care facility here in Utah. And they are doing a very good job and being very diligent in terms of working to protect their residents. And it happened in this case as well.
I guess secondly, can you explain why facilities with these deaths are not identified? Should the public know where these types of things are happening?
So in public health, we do notify the public of facilities or locations when it's important to protect the health of the public. In these instances, we're able to identify anyone who is specifically exposed and reach out to them specifically to alert them of their potential exposure. So there's not really a need from a public health standpoint to notify everyone. And then in addition, specifically to long-term care facilities, I mean, this is where people live. So us announcing the facility would be akin to us announcing the address of any of our individuals who died. And we don't do that because we really want to make sure we protect the identity of anybody with COVID, especially if they have a family member who passed away.
Is there, when you have a situation like one of this one where you have 7 deaths, is there a postmortem on it? Is there like an investigation to see what way have been different here than another facility?
Yeah, so we work on that continuously throughout all of our outbreaks. Every facility has a different number of patients, and the initial exposures are different. So that really impacts the rate of transmission. And so we'll certainly be doing that, after the fact as well. But but I can tell you that in all of our outbreaks, both the facility and the Department of Health acted quickly and swiftly to be able to prevent as much spread as they could.
Thank you.
Hi, Dr. Dunn. I'm curious about some of the long-term effects of severe COVID cases. With more serious cases and hospitalizations, do patients face any sort of permanent or long-term consequences? So just wondering if you could kind of respond to that, I guess, generally, and then what we've seen with patients here in Utah.
Sure. So I would say in general, we're definitely too early in this outbreak to be able to know the long-term effects of COVID-19. However, we do know that there are long-term effects, for example, for being on a ventilator for a while. Somebody who's been on a ventilator is going to become very weak and prone to other infections, and it takes them a very long time to rehabilitate, and that's going to be similar to our COVID patients who are on ventilators as well. In terms of long-term lung damage from COVID specifically, that kind of data and information is going to come out over time, but we're just too early in the outbreak to understand that.
Yeah, Dr. Dunn, it's Ben Winslow from Fox 13. Salt Lake County's mayor is issuing her health orders to largely mirror what the governor is doing with the additional requirement of face coverings being required in any public-facing buildings. I was curious to see if the Utah Department of Health planned to issue any more stringent health orders affecting a statewide level regarding facial coverings or things like that.
So in terms of the Department of Health at the state level, we are definitely aligned with the governor in his orders and directives. And we give him direct advice to make those policy decisions as well. So anything that comes out of the governor's office is going to be essentially out of the Department of Health. But we certainly support every local jurisdiction's ability to increase the restrictions or policies due to COVID-19, because it is important to understand that this virus is spreading differently in a lot of communities. So it's important that local policymakers are able to make those decisions for their own communities.
Hey, this is Peyton with the Tribune. I was wanting to know, the CDC announced new symptoms today that could, somebody might have COVID-19 if they have these symptoms. Will Utah's testing open up to these people that have these other symptoms as well?
Sure. So there's 3 symptoms on the new CDC guidance that are not currently included in our 6 symptoms for testing. It's headache, chills, or rigors, which is basically shaking with chills. CDC requires 2 symptoms to be able to get tested. We only require 1. So I'm confident that we're not missing anybody who should be tested for COVID-19, but it is something we'll evaluate with both our specimen collection sites and our subject matter experts, both at the clinical level and laboratory level. But at this point, there's no plans to change it. But it is something we'll look at.
Got it. Thank you.
Okay. Thank you so much. This concludes our briefing.